It is National Antibiotic Awareness Week, a global campaign to raise awareness about the responsible use of antibiotics and the growing threat of antimicrobial resistance. I don't know how they're able to say all these words. Joining me in Studio B is Dr. Joliff with Kern Medical, the pharmacy director. Thank you for coming in this morning to talk about it. And it's the perfect time, right? This is the time that everybody gets sick, they lose their voice and whatnot. Talk about the importance of this week and the awareness aspect of it.
Yeah, absolutely. Yeah, we're now in the middle of flu season and cough and cold season, so now is a good time to do it. Every year, the CDC sets aside this week to bring awareness for antibiotic resistance and the importance of appropriate antibiotic utilization. So often, we're overutilizing antibiotics, and this is one of our most important resources in healthcare to help make people better. But just like any tool, if we overutilize it, it's going to be dull and ineffective. So.
And how bad is it this time of year?
Oh, absolutely. This time of year, we start to see a lot of people go into urgent cares, cough and cold symptoms. But the purpose of this week is really to level set those expectations. People go to that urgent care because they have a sore throat, cough and cold. They want that antibiotic. But if they leave and they only have a cough syrup and a fever reducer, they're almost mad sometimes because they didn't get that antibiotic. But so often, it's actually a virus causing that problem, and an antibiotic's not even needed. So
now, a lot of times, are we doing ourselves a disservice in some cases because we're sort of like not allowing our own immunity system to take care of it? Or?
Well, lots of times these upper respiratory tract infections are actually just viruses, and your body gets rid of it by itself. Your immune system gets rid of the virus, and over a period of a week, you get better. But so often we're going to the urgent care and the primary doctor's office and getting that antibiotic, which does do a disservice because antibiotics aren't without risk profiles. Some have some side effects. Some can increase your risk of having diarrhea and some other unpleasant side effects. So we really just want to have the expectation that we're going to have that conversation with our provider. Is it a virus? Is it a bacteria? And get the appropriate medication. We do have some antivirals too that work for virus. Perfect example, if you test positive for flu, we have a great antiviral called Tamiflu. Works very well.
And that's over the counter?
It's actually by prescription.
It is prescription, okay. Another one that I love to talk about, and we were just going to, people love to reach for that Z-Pack.
They do. I mean, even most pharmacies keep it in a fast mover section, so they can just grab it. I'm not even joking. It's very common, but a Z-Pack works great for bacterial infections, but so often it's a virus, like a rhinovirus causing a cough and cold, and that antibiotic's doing you no good.
So it's almost like it's that knee-jerk, oh, I've got sniffles and whatnot, I need a Z-Pack.
Yep.
That's it.
So many people have that, yeah.
Oh, incredible. Now, about this week and everything, when you're sort of talking about, you sort of alluded to it a moment ago, that that over time, in specific circumstances, they can become ineffective. And how dangerous is that aspect of it?
It's very dangerous. There's 2.8 million infections in the United States every year caused by resistant bacteria, and that accounts for 35,000 deaths. So this is a serious health, not emergency, but in the last 20 years, we're seeing where antibiotics used to work for certain types of infections no longer are. And a common thing we were talking about earlier is, used to a urinary tract infection, almost all of our oral antibiotics would be effective for that. Now it's so common to see patients admitted to the hospital for antibiotics because they have resistant urinary tract infections. So we want to use antibiotics in the appropriate place, finish antibiotic courses, not having a few pills, for next time. That's always a bad idea. But yeah, we want to use our antibiotics appropriately.
And I wanted to finish on that. Don't save the antibiotics for later if you don't finish
Don't do it.
That's bad.
Bad idea.
All right, Dr. Joliff, Kern Medical Pharmacy Director, thank you for coming in and talking about this, especially now that we're in the heart of this whole cold and flu season. We'll be right back.